And also let you know that she is a biologist.
Been away. I'm told that some of you had to be bussed in from wherever you are working and practicing. And it's a great joy to see every one of you. I also want to thank members of staff and faculty who are here, because we are here for students. Sometimes you think we are in administration just for administration's sake. No. We are in administration so that we can come up with programs that meet the market needs. We are here so that we can help chart the way forward in your studies. And we are here to be mentors and guides as you do your classwork. Let me begin my remarks, very brief ones, by reminding us of the goal at independence of any of our countries, including Kenya. Our founding fathers were fighting three things: illiteracy, ill health or sickness. They were also thinking about education. And I wonder, when you reflect, for example, in Kenya, what kind of dent we have made in any of these areas. Levels of literacy, they have increased, but we still have some people who can't read and write. And it's a terrible world for those people without these skills that we are now taking for granted. Because as we have developed in use of technology, it is becoming more and more important that you become literate. Because if you walk into a place and you can't read the signs, you can't tell where to move next, you are lost. You are in great, great darkness. And that is what we have seen happening. We are thankful to God that we have improved, especially in Kenya, in this area, but we are not there yet. And I think for this generation here, especially students, this is a world that you may not know of, where people are in that darkness of not being able to read and write. And you, in public health, may also consider how important it is for people to be able to read, write, follow instructions, have critical thinking skills that happen even as you get an education like you are getting. Of course, the question of health, this is in the center of this. Public health, for this matter, where we are talking about communities and their great awareness about health. Where I come from, they say that you should not eat raw mangoes because you get malaria. That's the connection. And there are many other connections like those in our country and in our communities. You have this mark on your face because somebody looked at you with a bad eye. Yes, Dr. Ppe knows. So health issues are connected with the world out there. The world of witchcraft, the world of magic, the world of mystery. Don't sweep at night. Somebody will tell you. Why? What will happen when you sweep at night? You sweep? You sweep your wealth out. You become poor. Don't play in darkness, children are told. And this, especially as community health students and practitioners, are some of the things that could involve or be involved in your research. Because we are talking about beliefs of a people, of a community that affect their health choices. So I don't know, out of this presentation, whether anyone will be touching on that. If they are not, we start saying, think twice. Oh, somebody is nodding his head. Good. Because the beliefs that people have about their lives is very important. You could say everything you want to say about washing hands, wearing masks, vaccinations, and the things we are talking about. But if somebody has very deeply held beliefs about the uselessness of those kind of practices, you really have a hard time convincing them. So health is in the middle of your discussions, and I'm sure we are going to hear very many other things. But alongside health are the community values and beliefs, including religious beliefs. There are many people in this country who do not care about modern medicine. They will expect people to come with anointing oil, anoint them, pray over them, and they will be good to go. True. But those who are Christians know that Jesus at one point made a mud paste and put it on the eyes of somebody, and the person was able to see. So there's a connection, there's a relationship, and there ought to be a very rational way of looking at things. When do you get the vaccine? When do you get the injection? When do you wash your hands? When do you get our regulators at different levels? So students, be confident about the kind of courses that you're undertaking. And we are thankful that we've had this program for the last 10 years. And it is growing from strength to strength. Our master's program is on its way, as you have been told. And soon, some of you may be thinking of joining that master's program. So I want to thank everyone who's been behind this effort. University of Maryland, for the MOU that was signed between ourselves and DASTA. And I believe that MOU is also very wide. It covers different disciplines and levels of operations, and this is but one of them, all in the context of the university offerings, both in training and in research. So it gives me great pleasure to welcome all of you, and especially the students. It will be very interesting to hear what kind of ideas you have by way of research, that you'll be open to listen to additional ideas that could strengthen your work and give you very many new perspectives. So welcome, everybody. And now I'll take this opportunity to welcome Professor Agnes Lucilando, the Director of Research and Graduate Studies, who has been part of this work and may have, I'm sure, some things to say as we now slowly or very quickly move into the presentations, because we are a whole hour behind schedule. Thank you very much, everybody.
So, our Vice Chancellor, Professor Laban Pichairo, who is arriving, our Deputy Vice Chancellor, Academic Research and Student Affairs, our directors, Principal Nairobi Campus, members of Senate and management here present, and our visiting guests, led by Dr. B, as she's normally known, and our guests from the University of Maryland, students of Daystar University who have done great steps to be here today. Good morning. Good morning. Thank you very much for finding time. Mine is very brief. I want to make 2 comments from what I've heard the DVC ARSA talking about. And we are proud of the students who are going to do their presentations here. The 2020-2025 strategic plan of Daystar University has research as priority number 1. And for a long time in Daystar, when we talk about research, we're talking about research that are being churned out. We are talking about graduate students, we are talking about faculty. But I'm here to interest the undergraduate students. First of all, to endorse what you are doing so far under your dean and the heads of department, but now to encourage us more. What can we do as undergraduate students to contribute to that agenda of priority number 1 of research? One of the students accompanying Dr. B here is an undergraduate student. He has gone with Dr. B to Sierra Leone, conducting research. They're here in Nairobi, Kenya, conducting research. Then they're flying to Kano in Nigeria, conducting research. Where are our undergraduate students in matters research? We cannot say, I'm waiting until I begin to do masters or until I begin to do PhD. So research is for all of us, and it's good that we get to be interested because then that gets us going. So, the challenge here is then also for the faculty. When we do our big papers, when we do our big research grants, when we travel the world over, who accompanies us? Are we mentoring the undergraduate students, as Dr. B is doing, touting the globe with an undergraduate students to learn research and to learn how to publish? So we shall show the young ones where to go if we involve them. So that is my plea, that we involve them. And at the same time, students, please hold on to the dresses and the clocks of your faculty. They didn't know who I was, but there was 2 students were complaining to their friends. Dr. So-and-so has given us a whole chapter to read and summarize. A whole chapter. And so the other one saying, are you serious? A whole chapter to pay research permit to conduct research in Kenya. First, to get the ethical clearance from her own university in Maryland. Then trying to get research in Kenya, the Kenyan research protocols in terms of ethics. And Daystar is one of them. So other universities, other research institutions come to us. We must learn to get the research ethics clearance from ourselves or from other recognized institutions. It is not a pain, it is not a delay, it is a necessity because it protects the researcher as well as the undergraduate students coming to our desk for clearance or disturbing us. How many of the undergraduate students are involved in the conferences that are going on in the university, in publications, and disturb your faculties? Those questions of, seriously, a whole chapter should change. God bless you. Thank you very much.
I see our Vice Chancellor is coming. And he was to introduce the guest, but I can also do that as he is coming. And it's our joy to welcome Dr. B. And we'll go beyond Dr. B, I'm sure. Dr. Dina L.G. Bozworski. Did I get it? I'm close? Close. So she is the director of the Global Health Initiative and a research professor, department of that. It's a beautiful longer name.
So, are we in morning still? Good morning. Oh, okay. So I am traveling with my undergraduate student, Tevin. He is in his 4th year as an undergraduate, interested in chemistry. This is one of my doctoral students. You will see great things from her in the future. You'll see great things from her now too. And her husband Tayab, who is accompanying her. And again, thank you very much for hosting us. I am grateful for my friendship. We can't even figure out when we met, Professor Agnes Lando, my sister, and I am hosted also by your Vice Chancellor, Dr. Ayiro. I also am grateful to Dr. Monica Apio and Dean Martha Chiare. Thank you very much for your hospitality. To the deans and professors and students in the room, I hope that this is just the beginning of our research relationship, our education relationship, our practice relationship. So we're going to hear from the students, and I'll make some comments afterwards.
Sorry. So I think the students have really worked hard, and it's now their time. I think everyone is so anxious. People are asking me, when am I presenting? Am I number one, number two? So now we are here. People have worked so hard to make their presentations. People have corrected their work and, done personal presentations to themselves and to others. So I think this is your day. We've already taken so much time. So we'll start with the ENH students, the public health students. The first presenter will be Nyingi Wahome, followed by Marlene Kwamboka, Ivy Mogondu, Claire Amdani, and Jeremiah Marwa. Then we will call the others. So please, Nyingi Wahome, welcome. Let's clap for him as he comes.
All protocols observed. Good morning. As you've heard, within Nairobi City, it's a slum. It's a wide area of informal settlements, okay? So a lot of effort during quarantine was put into, or during COVID was put into quarantine and withholding the movements into policy would increase the effectiveness of the guidelines that are put in place, okay? And within urban Kenya, the ratio of traditional medicine practitioners to patients is 1 to 833, okay? Just to give you an image, we are failing in the number of doctors we have, okay? But WHO recommends a ratio of 1 to 1,000 doctors among, within a country, okay? That need is met by traditional doctors more than actual doctors, okay? So it's clear. So specifically, I plan to identify the disease treatment options that are highly used. I plan to determine the residents' perceived prospect of recovering from these different treatment options, to determine the average cost of the disease treatment options,
a role in infection prevention and control in healthcare facilities. So in conclusion, there are myths and use of PPEs like masks, and one of the best approaches that can be used to tackle this issue of vaccine hesitancy is education. However, the data collected from this research will go a long way in giving perspective on what more needs to be done, and therefore I recommend that a further research to be conducted on the proposed research topic. Thank you so much.
Jeremiah Marwa.
All protocols observed, ladies and gentlemen, good afternoon. My name is Jeremiah Marwa, and I will be talking to you about COVID-19 prevention from an immunological perspective, viruses. And genetic evidence indicates that a cell-mediated innate immunity plays a key role in resistance to COVID, and soon enough, we are going to do away with these measures. So we must have a solution that will be applicable in the long term. Then we want a one-size-fits-all solution that is easy to comprehend. Then routine, something that we can accommodate into our daily lives so that we can continue with it in the long term. So and investing in a strong immunity will be a game changer as it borrows the healthcare system time before a vaccine can be developed if a pandemic occurs. You will remember very well in the initial stages of the pandemic, we had to rely on our natural immune system to fight COVID. That's why people could focus on eating well. Some of us were taking a lot of tangawizi just to have our immune system in check. So the objective is to establish a prevalent vaccine Ppe Is at the community level. This is so serious because the government is using resources to get vaccines from abroad, but what do we do in return? We don't take vaccines, and we have some very funny beliefs going on, so we need to educate people at the community level. The methodology, mainly it will be through interviews. We want to analyze data from research centers and in Kenya and abroad to find out what's really going on and how we can improve the immune system. We want to interview COVID-19 isolation and treatment centers, healthcare workers to get the real picture about the confirmed cases. We also want to interview public health specialists, the age of 65. Then obesity is another problem, and it's attributed to lifestyle. We also have 31% of Kenyans fully vaccinated, and this is really a worrying figure. We also have 51% of Kenyan adults in 2019 suffering from more than one NCD. And you know, non-communicable diseases play a key role in being a high-risk population. So in the discussion, I will just summarize because time is not on my side. Approach, and we will be using basic public health measures to have all these things in place. So in conclusion, as we continue to flatten the curve, my recommendation is having we want to create a healthy nutrition plan that will cater for the needs of different people in the population, especially the high-risk group. We also encourage a healthy lifestyle through exercise and discourage drug abuse, especially smoking, because smoking is attributed to acute respiratory conditions, and hydrate, vaccination, and having enough sleep. Vaccines goes along with the nutrition. Healthcare can also be expanded to the preventive level by using data obtained in this context to monitor and...
We'll have Lian Otieno, Linda Odhiambo, David Mulandi, Grace Kahoya, in that order, and it's 5 minutes.
Deputy Vice Chancellor, our Dean of School of Science, and the Easter family, good afternoon.
Good afternoon.
My name is Lian. I'm a biomedical student, and proper waste management. But this research diverts a bit and talks about how the environment mainly affects the public health. And for my study, I focused more on the waste tires. Actually, waste tires are a big threat to the environment. This is because we find like they bring a soul of waste. Thus, to waste tire disposals. Determine the components of, reach out to many people, because when we mainly talk about sanitation, we only think about water and how fatal to the environment. For my methodology, the research will be 19. The methodology will also include, when we look further on the results, we find like there was a way that came up in order to manage waste tire. So we need to find other better ways other than pyrolysis that can be effective so as to ensure that we do not dispose waste tires carelessly. In the discussion, we get that due to the waste tire disposal through burning, 25% of people have cardiac and respiratory illnesses. We need to establish a clear legislature on how waste tires have to be disposed. Then we should have better methods on how we can dispose these waste tires, such as making furniture out of these waste tires, because it will reduce cases of cancers and respiratory illnesses. And two, it can also do it. Thank you.
Cynthia, Linda. 5 minutes. Please look at the timekeeper.
At some point in your life, you've used sanitary pads or you're still using, and I don't know the methods you use to dispose them. Maybe at a certain point in your... I know we are living in a modern world, and with technology, there has been the introduction of sanitary pads compared to the olden days where people used that will be presented here are from a research that was done in 2017 by the Kenya Menstrual Hygiene Management Board and Ppe Is and the effects that it could have on the human being's body. So the preliminary data shows that there are different methods of disposal that have been used in Kenya, and these ones include, the methods include crude burning, disposal through garbage collectors, disposal in pit latrines, but generally most schools and families dispose menstrual products using pit latrines. However, in burning areas, this waste is either collected or thrown into a rubbish pit and thereafter burned, or it could be left unburnt, and this is the one that will have the effects on the environment. So the discussion shows that sanitary pads, they contain superabsorbent polymers, SAP, which do not decompose. They break down into microplastics, and after some time, when pads are improperly disposed, they end up in landfills where they contaminate our water supply. This makes them unconducive for human consumption. They also contaminate the soil, making it unconducive for plant growth, and they contaminate air and enter the food chain, injecting toxins into the food humans and animals consume. This is a threat to human life and animals. So that is why my study is based on assessing the current state of affairs in terms of sanitary pads disposal and whether there has been any improvement. And since sanitary pads take long to decompose, they take about 500 to 800 years. Disposal at household level, this will greatly help in curbing this vice. And I would also propose that this project be funded for studies so that I can do it and help assess on the current state of affairs to help know on the state of the environment in terms of sanitary pads that have been disposed. Thank you.
David Mulandi. David Mulandi, 5 minutes, then Grace Kahoya.
I know we all know that we've all been in a global pandemic and we've all gone through sanitization and masking and social distancing. But the general population in Kenya have kindly let loose of that. I mean, just from on stage, seeing the number of people wearing masks, the social distance. All right. I am one of the people who raises my hands because The flu has been going around. Currently in Kenya, we call this season flu season, which is basically a time in the month, or rather in the year. If we look at COVID-19 when it first began, and we see how effective masks and these preventive measures were, once they were brought into the game, and once people started masking and social distancing, what happened to the rate of COVID? In specific areas where it was legislated, COVID reduced. And now when we are not wearing masks as often and we're not social distancing, the rate of COVID-19. There's been a sudden increase in the severity of this influenza virus. Kenyan experts have thought that this outbreak is a mild wave of COVID, as I said before. And since during this period is the politicians hold campaigns, and these campaigns have a large mass of people coming to listen to these politicians. Now, I only see them on TV, but many of the people there don't have masks and not social distancing, and the chance of them having a sanitary.
Grace Kahoya.
And today, I'll be going to public health measures and preventive actions against COVID-19 in Nairobi County. So Nairobi County entered through the corona was first identified in December 2019. It rapidly spread across the world and the globe, and the World Health Organization declared the outbreak as a global pandemic on 11th March 2020. And for COVID, the most vulnerable people are the adults. We all know there were a lot of controversies and myths circulating all over the world, including the main one was once you get vaccinated, they had negative effects, and people came up with myths about them. And then my other objective was to determine the effect of the different measures put across, and then to assess the different types of treatment on the COVID virus. For the methodology, the study shall be carried out in Nairobi County among a group of people following acquisition of the required approvals from ethic boards and NACOSTI. NACOSTI is the National Commission for Science, Technology and Innovation. Professor Martha Kiarie had mentioned about it, and it's, yeah. Going through the documents and records on the previous diseases that are similar to COVID-19, for example, influenza, and look at the prevention measures that were used back then. We had that the research for the medicines that were supposed to be used for COVID, they didn't start working on it like in 2019. It was something that had already started before, and that's because there were other pandemics that took place a few years ago, and they were kind of similar to COVID. So for the results, after collecting enough data, I was able to get results on the preventive measures given by the WHO to reduce the spread of the virus. There were many preventive measures that included wearing masks, we all know that, washing hands and with clean water and soap, keeping a distance of at least 1 to 1.5 meters from the other person, avoid shaking hands, cough and sneeze into your elbows, and lastly, get vaccinated. And then on the point of wearing masks, because that was the most common one worldwide, it really helped a lot, but it also had some negative effects on the environment because it caused pollution, especially water pollution. This is because most of the waste and litter on land was disposed in rivers and masks, and the masks had plastics which suffocates the aquatic animal. So that is all pollution. And then getting vaccinated is the most effective measure, but many people across the world refuse to get the vaccine due to the many controversies that were circulating, like once you get vaccinated, you will die, and some even believe that once you get vaccinated in like 1 year, we'll turn into zombies. That was, yeah. And then the preliminary results of the similar study carried out by WHO in Nairobi showed results as shown in the graph below. So the graph, the first one, It's the cumulative number of confirmed corona COVID-19 cases in Kenya as of March 31st, 2022. And as we can see, the first one is Nairobi County, and it had the most cases. And then the second graph is about the number of vaccines that were given out. So at the beginning of the COVID-19 pandemic, not many people accepted to be vaccinated or wanted to be vaccinated, but through the years, people learned and they got to see that it was really necessary and for their own good to be vaccinated. So, yeah, and for my conclusion, after this research, I came to a conclusion that these preventive measures that were put in action worldwide have really helped to reduce the rate of infections. The references, like for the graph, were from World Health Organization, consideration and implementation, and adjusting public health and social measures in the context of COVID-19, graphic routers, COVID-19 tractors, and Statista, Health Pharma, and MedTech State of Health by Julia Faria. Thank you.
So we'll have Ida Musumbi. Ida Musumbi.
Proper disposal of PPEs on public health. So, what are PPEs? We all know that PPEs are personal protective equipment and not just masks, as we all know. PPEs are worn every day, everywhere. It's the new normal. We have learned to embrace them, but there's more to just throwing a mask. It could include gowns, headgears, masks, gloves, gumboots, and gumboot covers. And it's just not worn anyhowly. There's a way we wear our PPEs. We start wearing them we first start wearing our gumboot covers as we head up. So our final, what we'll wear last would be our headgears after wearing our masks and gloves. My objectives for my research would be to determine methods used to dispose PPEs, to assess areas in which PPEs are disposed of, and to evaluate the public attitude on PPE disposal. My justification would be that improper disposal of PPEs which carry infectious pathogens poses a risk of increased transmission, morbidity, and mortality from the COVID-19 virus. The methodology includes that they collect them from different places and dispose them in one area. So I came to realize that the public had complaints about how PPEs were disposed, in that they complained that the chimneys were too low. So they realized that PPEs were given out to hospitals and medical places through donations, and the government, especially through KEMSA, which is the Kenya Medical Supply Authority. The medical practitioners preferred government PPEs to donations, in that they say that the donations were rather heavy or they had limited sizes, so they preferred the conclusion. I would like to just say that it poses there's greater stigma in society that needs to be addressed, because as people wear PPEs, they think that these people are sick and they have corona. However, there's been a decline in the way hospitals use PPEs because of medical or administrative ways in which are not handled well, so they do not get them as frequent during the coronavirus time. So there's been, therefore making it difficult to establish good grounds of safety versus psychosocial aspects. And therefore, there's been laxity and floppiness in handling hygiene and sanitation that needs to be addressed and create awareness. Therefore, we are the difference to make the difference, and thank you all for your time.
Alois.
As Professor Martha Kiaria said,